Did you know the most common side effects of ADHD medication include suicidal thoughts, high heart rate variabilities, lowered sleep, decrease in growth, and irritability, just for the things that they're supposed to help with? I'm Dr. Khaled Menkel.
And I'm Dr. Sept.
We're pediatric chiropractors here in Barrhaven, Canada. And we want to tell you about an upcoming workshop that we're so excited to present to you here next week, Monday, September the 22nd. And Dr. Herr, we're both parents. We see just amazing potential for these kids in a combined practice of 30 years. And the most common things that we see with these kids is the way that their brain is wired.
Yeah.
Right? So what are the common concerns, and how have we helped some of these kids in a different way without really giving them drugs that are really only addressing the effect but never the cause?
Well, you're correct. When parents come in, the two biggest things that they're concerned about is we're not addressing the cause and, as you mentioned, the side effects. Right. But from the pattern and working and helping these kids, what we've noticed is, as you mentioned, is the way that they're wired. A very stressful birth. Whether there's physical stress or emotional stress that happens where there's tension that's created at the top of the spinal cord through the actual birth process, and what happens is it just gets these kids into this fight or flight mode. So they're constantly firing in what we call the sympathetic part of the nervous system which is the fight or flight versus the rest and digest part of the nervous system.
And a good analogy is that these kids are kind of wired with a Ferrari brain, but they got bicycle brakes. So our role is, and we found that there's a common history in that they've been through a traumatic birth process where they either been pulled out through forceps, vacuum extraction, and the amount of pressure, as you mentioned, Dr. Herr, the pulling of the baby's neck through the birth canal is enough, 90 to 120 pounds of force is enough to misalign the skull of the first vertebra. And initial symptoms that we see, doctor, are commonly a lack of ability to breastfeed because they can't maybe turn their head to one side to get the latch. So mom thinks it's a problem with her, but maybe it's actually the baby and the way that it came out. That's one of them. And what's another common early sign possibly?
Well, one of the other things that's very common is you see these babies, when you have a baby should be just relaxed in your arms. These babies, the baby should be like a floppy baby. These babies are very hard, they're rigid. And another thing I've heard from our research and preparation for this workshop is that a colicky baby is an ADHD baby. Right?
High potential for it.
High potential for it. So once again, there's stress in the nervous system. They just don't get to express the rest and digest the autonomic part of the nervous system.
Right. And some parents had concerns with their kids either getting adjusted, and is there a safety issue, and how do we adjust kids? Are we using some what I call traditional chiropractic adjustments, or is there different ways of adjusting these kids?
The biggest question that we get from parents right before we make an adjustment is, is this going to hurt? Well, the amount of force that we use on infants when we're making an adjustment is the same amount of pressure that you would use with your hands as if you were checking to see if a tomato was ripe. Yes. So the same amount of pressure you would place just on iron. So very gentle. The way that we adjust and we take care of children is very different than we take care of adults.
Exactly. We have some special technology called thermography that we actually run along the spine to measure the stresses in the nerve system. It gives us a printout reading of sort of where the balance of the nervous system is, and a lot of time we'll see these red areas that tells us a high stress in that part of the nervous system. So again, we had just amazing success in over the last 30 years of combined practice, and some of the stories you can see on our YouTube channel. But we really want to bring this workshop to light because there are other ways to allow the kids of our future, Dr. Herr, to really express the potential and really just helping them unwrap the gifts that they really have. And I think, drugging them is not going to be the first choice for these kids because of the adverse effects, what it does to their future. So, Dr. Herr, how can they sign up for this workshop?
What you can do is you can visit Eventbrite and you can look for Shining with ADHD.
Right.
We're going to be doing the actual workshop on September 22nd at 7 p.m. Right here at the office.
So Eventbrite, Shine with ADHD is where you sign up. September 22nd at 7 o'clock, and please register there, and we look forward to seeing you.
Take care.